Hi, I am Dr. Karthik Madhivanan, a consultant liver specialist. See, a liver disease as such doesn't mean that it's liver failure. Okay, so liver disease can vary from any problem from simple, a cyst in the liver, or some lesion in the liver, or hepatitis. It's called a liver disease. Somebody's got an abscess in the liver, we say it as a liver disease. Got a liver disease, or if he's got a tuberculosis in the liver, we call it as okay, there's a tuberculosis disease in the liver. And when you say liver failure, it's totally a different terminology. So liver failure and liver disease, are not the same. But however, extreme cases of liver damage caused by liver disease can lead to liver failure. See, liver is a very patient organ. Okay, unless until 70% is damaged, it doesn't show any kind of symptoms. But however, there are certain common symptoms where patients present with jaundice, that is, yellow discoloration of the eye, and second is blood vomiting, and third most common is people present with swollen limbs and fullness of the abdomen, where we call it as ascites, that is water in the tummy. See, the most common cause of liver disease or liver, failure in our country is still alcohol. Alcohol, because liver is the one which completely metabolizes your alcohol. That everyone knows about it, and alcohol is still the leading and the common cause of liver failure. And second is the hepatitis related. See, hepatitis are like about 5 types of hepatitis virus are there: A, B, C, D, E. Most common liver disease is hepatitis A, which everyone in our lifetime tend to, get hepatitis A infection. It's a very mild form and it can settle down on its own. But chronic hepatitis such as hepatitis B and C can lead to liver damage called liver cirrhosis, and some patients even they present with liver cancer. And the third most interesting one is the non-alcoholic fatty liver disease. It's a spectrum of disease. We call it as a metabolic syndrome. Not necessarily that people only who drink will have a liver disease. People who doesn't drink, who are obese, who have diabetic, who have hypertension or lipid derangement in the lipid profile, or very stressful lifestyle can also lead to liver damage. We liver specialists are seeing a large rise in this non-alcoholic fatty liver disease entity. So in a decade, probably it might even take over alcohol, and it can be a number one cause of liver disease. It starts with a simple fatty liver and progress to liver fibrosis, and then to a permanent damage stage called liver cirrhosis, which eventually will require a transplant to survive. The moment it starts producing or showing symptoms, that means already it has crossed the 65-70% damage bar, and that's why you start producing symptoms. Some patients may be lucky when they go in for some other checkup or some other health disorder. When they get an ultrasound, then they might see that the liver is already early cirrhosis. But however, it has not reflected in any of the blood tests. So the liver function test is absolutely normal, and the patient doesn't have any kind of symptoms, but only that on imaging, either an ultrasound or a CT has shown us, okay, the patient has got a coarse echo texture or an irregular liver surface, which is probably a shrunken liver and it's a liver cirrhosis. And some people are lucky to reach out to us in that stage where we can still continue some medical management by some time till they get a transplant done. Somebody's got a fatty liver. I mean, people who drink more than occasionally, or already diabetic, or for a very long term, more than 5-10 years of uncontrolled diabetic, a patient who has got a deranged lipid profile. So these patients need to undergo a periodic liver checkup to see whether they have a fatty liver or not, because fatty liver diabetes is a worst combination, and it can lead to 50% of patients with diabetes and fatty liver can have a cardiovascular attack. And it's other way around, it's a vicious cycle also. So people who have fatty liver and all the other problems can itself lead to diabetes. So fatty liver itself can trigger diabetes. So people with these kind of high risk need to periodically check the liver as they check for the heart or a kidney or whatever. Every year they need to get an ultrasound or a fibroscan to see what is the quantity of fatty liver they have. Why? Because fatty liver is the one thing which is 100% reversible if they change their lifestyle. Just by simple lifestyle modification, the fatty liver can be completely cured. Yes, we do annual screening for high risk population. So if you ask me who are the high risk population, people who are diabetic for long term, people who drink alcohol more than occasionally, overweight and obese patients, patients who have hypertension, deranged lipid profile, and people who have very extreme stressful life. So these patients we recommend as a liver specialist to get an annual liver health checkup done through either a simple ultrasound or a fibroscan if it is available, and the liver function test every year, just like we check our heart with an echocardiogram. Yeah, as we all know, sedentary lifestyle, it's not only it damages the liver, it damages every organ in the body. I mean, every specialist, be it a heart, be it, a neurologist, they all talk about lifestyle modification because people think that, eating fatty food is harmful. No, it's not right. Fatty foods doesn't cause fatty liver. It's the carbohydrates which we take in excess that tends to get converted into fat and gets deposited in the liver. And everyone should be conscious about the amount of carbs they take every day. There are certain healthy fats and healthy proteins which are not harmful, and it is very easy to burn them as you do your routine work. It's a must for every individual who crosses 30 or 35 to do at least 20 to 30 minutes of cardio, where cardio, when I say not simple walking is cardio, people do please do understand that simple walking doesn't help. You need to intensify or increase your walking speed or even a mile jog where you increase your heart rate. That's how you burn calories and keep yourself fit. So avoid all kinds of oily and junk foods, especially the bakery items where a lot of maida food stuff. It's very harmful. When you say balanced diet, it means 60 to 70% it should be proteins, 20 to 30% fat, and 30 to 40% of carbs. That's what a balanced diet is. In our Indian food style, 80% of a diet intake is carbs. Predominantly, it's carbs. Carbs are the culprit. We need to cut down on the carbs.